Yeah, happy Women's Day. Welcome, everyone. And we really appreciate you making it to this session. Today is a special session. So if you're okay to unmute yourself, put your camera on, we can have a little bit of celebration before we enter into the session. We'll really appreciate. Thank you, Karen. Yeah, if your connection allows. Thank you, Lan. Hi, how are you?
Hello.
Hi. So if you can stay unmuted, if you're not in a noisy place, we really appreciate because we want to celebrate in our way the International Women's Day. Hi, Kajuju. I can see you. Thanks for putting the camera on. So as our activity, just to bring us in the same room. Hey, Sylvia, I can see you. Thanks for joining. So as we wait for other people and we celebrate today, we wanted to ask people if the connection allows to unmute, or if they're in a noisy place, they can write in the chat box. But we want to hear how you are celebrating today. What are you doing? Share what is happening in your organization, in your community. Tell us, how are you celebrating today? We'd really love to hear from you. Anything? I can see Karen is unmuted. Karen, did you want to share what is happening in your community, in your organization?
Yeah, today we are getting the government to complete the international day from I supposed at 2 p.m.
Oh.
And I think into the distribution of
you're breaking. From my end, Karen is breaking. If you're able to hear Karen, that's fine. But I really thank you for sharing, Karen. If you want to write it again and put it in the chat so we know how you are celebrating the International Women's Day. Anyone else with who wants to share about what they're doing? Welcome, Selimpilo, Cipriano. Thank you for joining. Happy Women's Day, everyone.
Yeah, happy Women's Day.
Thank you. And are you celebrating it in a special way at your organization, in your community? Would like to hear from you.
Yeah, thank you, Rita. Actually, I just finished updating or publishing the activity that we did with the community and also with our partners celebrating International Women Day. So we had amazing and interesting activity conducted at one of the community schools, and more than 100 students, teachers were involved, and we offered dialogue around the issues on young women and how we encourage teachers and also boys at the school to really support young women at the schools, and as well as we offered free services, reproductive health and medical mobile service to the students, especially young women who face the reproductive health and access the free services during the session. We also provide nutrition cooking class or nutrition cooking skill to the students, especially boys, how to cook and to help women. We also provide holistic referral assistance using digital and technology, how young people using mobile phone, Android, Facebook to connect with our youth worker at the Youth of the Streets in Timor-Leste. So we just finished that activity with the partners, and I have just finished the publication. And that's all to update. Thank you.
Thank you so much, Cipriano. That sounds like a lot you're doing. And I'm sure many people are doing, and I'm seeing already Karen telling us that they are doing a charity work, which will culminate into distribution of reusable sanitary pads to adolescent girls. What's an activity? That's amazing, Karen. And I'm also seeing that Kajuju, you'll be celebrating with a group of widows. That's so kind of you. Yeah, anyone who can share for 1 more minute? Otherwise, we'll share briefly and then, yeah.
Yes.
Okay.
May I share?
Sure, go ahead.
Thank you very much. This is Livia Turiamuhebwa from Care Uganda. We were engaged in different activities. One, we had the men cook for women at a certain market in Gulu. And it was interesting. The women enjoyed the food that was cooked by the men. Today, we are joining government in Chiruhura district. That's where our president comes from. That's where the national celebrations will be taking place. So CARE is joining other partners and government and civil society organizations celebrate the Women's Day. We also have community dialogues and other activities really in the communities. Thank you.
Thank you so much, and happy celebration to you all. This is amazing. Please, if you haven't got a chance to share with the group, please put it in the chat so we know what we are doing for this important day for all of us. And I'm happy to also share that I was lucky to be invited and attend the celebration at the Swedish Embassy here in Kigali, Rwanda. And we had so many people like from diplomatic corps, government, civil society activists. And the theme, like the theme that we have at national level, is looking at the technology. How do we enhance women's participation and joining the technology that is like a key or unlocker to development? So we had very interesting presentations and discussions, and I was so glad to see that people, as much as they recognize technology as important, they also recognize it can be a risk for young women who use it. And we were all, it gave us like a task to think about how do we do it in a safer way. And it brought me back to our session of last week. So yeah, just wanted to share with all of you. In the interest of time, unless there's someone with a really burning point they want to share, I'll take us through the session overview and the rest of the session today. Okay, is it someone who wants to share? Okay, that was Alfred. Anyways, thank you so much. We really appreciate, I want to say it again, we appreciate that you're joining us today, despite everything that is going on in your communities, in your organization, in celebration of the International Women's Day. So today, this is our way of celebrating. We're here to think about how do we do prevention of violence in a better way so women and girls can enjoy their rights to the fullest. So I'm happy we have this common understanding of the different ways we can celebrate. For today, Manon, if you want to go to the next slide. So our session today, we're going to do session 4, which is understanding causes to find solution. And of course, it's understanding causes of violence against women and girls and find solutions to that. Okay, so I'll go very quickly through the session overview, like today, what are we going to do today? Next slide, please. So that was our group check-in. We wanted to hear what you are doing in your communities, in your organization, and we really appreciate that you shared. We'll do a little bit of housekeeping. I think by now we know what promotes a good co-learning environment for us. So we'll go through that very quickly again. And then we'll do the review of last week. As usual, we'll start with one of you sharing their responses, their reflection, to the take-home exercise, and then we'll go through what are the key takeaways that we at the Prevention Collaborative, like the facilitators team, have put together for you. And then we will do the main session. I'll hand over to my colleague Benita, who will take us through the main session, which is understanding causes to find solution. And those are the points we'll be focusing on: models of causation, socio-ecological model, gender inequality and violence against women, risk factors and protective factors. As well, if we have time, we look at the triggers as well, okay? And as usual, we'll explain and send you with your takeaways. So don't think we forgot the breakout. We have the breakout group. Was that me? I
No,
heard
go
an
ahead. Go ahead.
okay.
Somebody
So
typed
yeah,
in
so we
on board.
didn't forget about the group work. It's just because it is today, it's a special one. It's incorporated in the main session. So we'll take you through that as well. Okay. So Manon, on a very quickly on the next slide. So we would like you to sign for the attendance today. And yes, so like I said, if the connection allows you, please stay on video and unmute when you want to speak, and please make sure that everyone has room to share their ideas. So and we stay respectful to each and everyone's point of view, and for a good sharing amongst ourselves. So the next slide, Manon, very quickly. So like Benita has just put in the chat, the attendance sheet for you to sign your presence. We appreciate you doing that, but if you're unable to do so, let us know and then we can sign for you. We'll talk about submitting the assignment as usual later on, but if you have any difficulty, let us know and we can assist. Okay, thank you, Shan. I noticed you've done so. All right, so next slide, Manon. Manon, can you go to the next slide, please? Okay, so like I said, every week we start with the review of the last week. We would have loved to let everybody unmute and say what point they took away from the session, but the best way you've done so is by sharing your assignments, your take-home exercise. And like it's our best practice for co-learning purposes, we had Karen, one of your colleagues, Karen Adrang, who accepted to share the reflections. And here we want you to know that most of the assignments were really good and we appreciate that you worked on them. Those who haven't got a chance to submit, please go ahead and finalize and submit as soon as you can. Otherwise, we wanted to hear from you, and today we are hearing from Karen. Karen, you'll give us a background of the program you are describing and take us through your analysis of how the principles were used. Thank you so much. If you can unmute yourself, Karen, we are listening to you. Thank you.
Thank you, Rita. Allow me to disable the video so that I got the connection.
That's right. Go ahead.
So, okay, women in the coast region of Kenya face significant challenges related to violence and discrimination. And this is worsened by high levels of poverty, unemployment, and even gender inequality. And we are dealing with cases of early marriage, female genital mutilation, sexual harassment, and even domestic violence. And this impacts significantly on their physical, emotional, and also psychological well-being. So we as Baobab is a community-based organization in Mombasa County in Coast Region of Kenya. We designed a project called Tulinde Kadzo, meaning let's protect girls. And here we are addressing the issues of sexual and gender-based violence among adolescent girls and teen mothers in Mombasa County. Our interventions are two. We have both the responsive service and prevention interventions that we are doing, such as we are doing awareness raising campaigns, social media, through social media, mainstream media, and even the radio and community meetings. We are also conducting training services, especially for community members, teachers, healthcare workers, and also the police and community leaders. We are also collaborating with the counselors and psychologists to support our girls with the counseling and psychosocial support, especially the victims, as well as the legal professionals like the lawyers to provide pro bono services to support the legal aid of the victims. Finally, we are also offering vocational training, that is entrepreneurship, handicraft, tailoring, financial literacy for our girls and teen mothers to become financially independent so that we can reduce their vulnerability to sexual and gender-based violence. So that is the background about our program. When we go to the principles, the next slide. We are dealing with we were not aware that we were addressing or we were implementing the principles until I attended last week's session. So I realized that most of the interventions that we've been doing have been part of the principles, especially for accountable to women and girls. We include or we put women and girls at the center of all our interventions, and we involve in the design, planning, implementation, and monitoring of the interventions, including evaluation and reporting. So that is one of the principles. That is how we are applying that principle of accountable to women and girls in applying the best gender power analysis. For us to develop responsive programs and services that address the needs of women and girls and not and root causes of SGB, we needed to understand first the power dynamics that are at play and who are the power holders. We found that the fathers and the men in these women's life are the power holders. And when we examine the gender roles and norms, as well as access to resources, we realize that the men hold a lot of power, and they are the purse strings so far. So that makes women vulnerability very, very, very high. So we decided that all our responses will be very responsive to address the gender power analysis. In the principle number 3, next slide, I'll talk about the strengthening later. I'm done with how we apply the principles. Inclusive and intersectionality. Among the target groups that we are working with, that is adolescent girls and women, we have people with disabilities as well as the LGBTQI. So we therefore collaborate with, there's a CSO, it's called what? Civil society organization in Coast. There's a network for civil society organization that has all types of civil organizations, including the LGBTQI and also the disability groups. So we are in that CSO, and that is where we bring synergy into our programs so that we bring all the stakeholders together. And this also helps us to respond to diversity and also address the root causes of discrimination and equality. In principle number 4, prioritizing the safety of women and girls, most cases of violence that we witness are perpetrated by close relatives, especially the uncles, the fathers, the cousins. So we decided to partner with organizations that provide access to safe and rescue centers, because once the perpetration has happened, the victim still stay with the perpetrator in the same house. And that now even exacerbate violence. So we decided to partner with organizations that have safe houses and rescue centers so that the victims can safely go there and leave the scene of violence for a while as we try to address as we try to intervene with our responses and mechanisms. So we have also designed a protocol as in our CBO, we have some protocols on how we can respond to SGBV cases. And we also have a child protection community mechanisms to prevent and respond to SGBV. And in collaboration with the government, we are also able to provide access to comprehensive services. These services include like referral to healthcare facilities, reporting to the police, providing legal aid, and offering psychosocial support services, and also access to safe spaces. In principle number, the last one, number 5, starting with ourselves. This principle, next slide here, we have diverse membership in our CBO, and not everyone has the capacity to respond or preserve SGBV. So we continuously provide training and even self-reflection every month during our meetings on violence against women. We also embed the culture of respect, inclusivity, and non-discrimination in our bylaws, as well as we also have a very progressive child protection policy that we try to follow. So just like I said that we were not aware we were implementing the principles until the lessons, we have, I've done some suggestion on how we can strengthen the principles on the prevention of violence against women. And just like you've seen, and because of time, I may not be able to expound much further on them. Thank you, Rita.
Wonderful. Thank you so much, Karen. Thank you. This was such, I mean, maybe people will agree with us that when we read your take-home exercise, we thought it's worth sharing because, like you said, it is clear that you had all the principles applied in a way, and I love the way you were suggesting, how can we improve? So I want to acknowledge here that even from the last session when we were talking about the principles and how you were labeling them in your organization, we do apply these principles, right, in our programming. Sometimes we don't know we are applying them. Yes, Fred, they will assist. We don't know we are applying them, but once you start thinking about a program to prevent violence against women, you definitely have to think about some of those principles. So like we said, these are the key principles, and I'm glad to see that in your program, Karen, and many other assignments we looked at, people are really paying attention to these principles. So this is important to note that, yes, you may be wanting to do this and to apply this, and the course, the reason we are sharing this in this course is that we want to share with people how can we uphold these principles. That's why when we're presenting the principles, we said, what is the principle and how can we apply? So we'll encourage you to go back and continue watching the video or reading the notes, and specifically on the how. Yes, we do apply these principles. Are we applying them? Is there something we can pick from the course that can help us apply them better to our programming? So thank you so much for sharing your take-home exercise. And I like the Tulinde Kazao program, and I will reach out to you to learn more about that. Thank you so much. Colleagues, if you have any reflection or question to Karen, feel free to put in the chat or put on our discussion board, and Karen can help us expand. Okay? Thank you so much. Now, what can we say after Karen's presentation and how she analyzed the principles? These are the key principles that we looked at in session 3, and the key messages we want to take You know, you can see all our 5 principles on the slide, and we wanted just to keep these 4 points, you know, in our minds, okay? Prevention principles help us to ensure that programming is effective and that it is implemented safely and ethically. Did you listen to Karen and to the presentation last time? We know why putting safety of women and girls has to be at the core of our programming. So that is a key principle, all right? So like Karen said, they didn't know they were applying all those principles. Yes, when you are doing programming, violence prevention programming, you apply various principles, and they are not mutually exclusive. They are rather interconnected and overlapping, okay? So make sure that when you are planning to observe or to apply one principle, you don't just stick to one or two. Make sure you apply as many principles as possible to make sure that you are effectively implementing your program and having safety of women at the core of your programming, okay? So this is an important point, and we're focusing on it again. These principles should be considered at all stages of programming, including when we're thinking of designing, thinking about planning. What is my program going to look like? Okay, mapping those people who are going to be your stakeholders. People will give you, contribute ideas. How am I going to check whether my program is, yes, getting the impact, but is also observing the core principles of keeping the women and girls safe? Am I applying it ethically? So you need to be thinking about these at all levels, including the monitoring and evaluation part of it. I think we discussed deeply about that. Those women who are respondents to any evaluation, are they safe? So safety does not need to be applied just when you are doing the activities on ground, but even when you are evaluating and thinking about, if she responds, am I sure that she'll be safe when she goes home? Is she safe? Is the husband or whoever going to know what the response she gave? Am I protecting her? So this is just to give you a clue of how do we need to keep these principles, thinking about them from beginning to end, and even when we are evaluating, okay? All right, and that was just a quick reminder of our 5 key principles. And again, these are the principles we picked from the Prevention Collaborative. There may be those who apply, you may be applying others, and we'd be curious to know and to learn from you, what are these other principles that you think are helpful for us to make a good violence prevention programming, okay? Thank you so much. We can go to the next slide very quickly. Yes. 8th March, we are going toward the end of our course. This is session 4. We have only 2 sessions to go before we finish. So next week, we'll be looking at prevention strategies. Of course, today, Benita will take us into the depth of understanding the causes of violence and how we can find solutions, okay? And then one way of finding solutions, as we keep saying, is to have some prevention strategies in place, all right? And then last one will be to look ahead. So what is next after the PE course, all right? So now, without any further ado, I will hand over to Benita to take us through the main topic of the day. Thank you all.
And thanks to you, Rita. Okay. So let's get started with the learning objectives of today's session. As usual, Manon.
Next slide, Manon.
Thank you. Okay, so here are our key learning objectives. Today, we will be looking at the different forms of causality and try to understand the causes of violence against women, right? And we will also explore the links between gender inequality and war. And today we will also try to identify what we call is risk factors and protective factors. And also, as Rita said earlier, we also plan to look at some of the situational triggers of violence against women. And to do all of this, we will be using a model known as socio-ecological model, which I am sure many of you are already familiar with. Okay. Now, before we get into the causality, next slide, Mano. Uh, Here, I would like to first start with the causes of different social or health problems. As we all know, these problems have different type of causes, right? And we also know that we first need to understand these various causes in order to develop prevention programs, effective prevention programs, right? For example, on the slide here, you can see two different models of causation from public health field, right? And we hope that this can help us better understand the causes of violence against women. So let's look at each of these models more closely, right? Next slide, Mano. Here. So first, necessary and direct cause. This is our first model of causation. And here we have taken a public health issue, malaria, as an example. This health problem has a necessary and a direct cause. Let me explain how. For us to get infected with malaria, there is only one reason. We need to be bitten by a female Anopheles mosquito, right? Also a mosquito which is infected by malaria parasite. So here, the parasite is the direct cause for us to get malaria, and it is necessary for us to be bitten by the infected female Anopheles mosquito. There is no other way for us to get malaria. Okay, so this is what we mean by necessary and direct cause. And once you get infected, of course, uh, for things like how sick you will get, or like, like the level of sickness, right? It will depend on other factors. For example, your general health, or how's your immunity, and whether you have access to quality healthcare, timely healthcare, all of that, right? So remember the first cause of first model of causation, necessary and direct cause. Now for the second one, next slide, the multiple overlapping cause. Here, again, we have taken another public health issue of heart problem, let's say heart attack, right? And let's think, what causes heart attacks? There could be many reasons. It can be hypertension, obesity, smoking can also lead to heart attack, and also eating fatty, oily food. It can also be a reason, right? So there are multiple reasons. But what we know is the presence of only one of these reasons or factors does not necessarily cause heart attack. So if I smoke, you can't say, oh, you surely have a heart attack now because you smoke, right? What happens is presence of all these factors increases our probability of having it. So if I smoke, there is a chance, and if I smoke and also eat lots of fatty food, it increases more risk, right? Then if I smoke, eat fatty food, and also if I have hypertension, then I will be more at risk, right? So this is why we said like heart attack is the result of multiple overlapping factors, not just one single cause. Okay. So this is our second model of causation. Okay. So now here I have a question for you. If we try to apply the same explanation to a case of violence against women, which of these models do you think will apply? Manon is going to launch a poll, and you should be able to choose like which option is correct. So which of these models that you see on your screen applies to war? Okay, so as you can see, like 100%, all of us, you have said war has multiple and overlapping causes, and we agree. Just like our second example of heart attack that we just discussed, no single factor is either necessary or sufficient to cause violence against women, right? Instead, as you all agreed, it has multiple and interrelated causes. And this is the first thing for you to remember from this explanation. Okay. And because of this reason that war has multiple and interrelated causes, when it comes to prevention of war, we also need to remember that war prevention also requires holistic strategies that addresses these different reasons or causes or factors that contribute to violence. And only one single strategy may not be sufficient to address all these factors that might be contributing to war in that context. Okay, so we move on to next slide, Mano. Okay, so yeah, here I would like to introduce the socio-ecological model. As you can see in the slide, at the heart of this model is an individual, and the different circles highlighted by color highlights different levels of the socio-ecological model, right? So this model demonstrates how an individual's health, well-being, or even behavior is affected by factors operating at these four different levels: individual, interpersonal, community, and society level. And I know that some of us might be new to socio-ecological model as well, right? So let me quickly explain these different levels. The innermost level, individual level, includes an individual's attributes, beliefs, and behaviors, as well as their own development history, such as the family that they grew up with, or experiences that they had, or what they had witnessed in their childhood. The interpersonal level, highlighted by orange color, it comprises of factors in the relationship, and this includes family or intimate relationship, like a relationship with husband or wife or with the friends, right? And the community level captures the factors in the individual's immediate environment. For example, where does that person live, in which community, where do they work, or which school that, like, where do they go to, like, for schooling or university. And lastly, the outermost green circle, it highlights the wider society. And this level comprises the broader structural environment, including relevant policies and legislative frameworks and economic and cultural influences on that individual. So this is the model, uh, socio-ecological model, right? And if you are wondering why I am explaining about it here, it is because this is a very useful tool, in our view, to explore the interaction between multiple factors operating across and within these four different levels, which increases or decreases the likelihood of violence. This model suggests that in order to prevent violence, it is necessary for us to address all these multiple factors across all these four levels, and only then it is more likely for our war prevention efforts to result in an effective and sustainable prevention over a period of time, which is not possible through any one single intervention targeting only one or two factors of the ecological model. Okay, can we go to next slide, Mona? I understand that, like what I just explained, it is a lot of information and is a little difficult to internalize immediately, right? So let me try to explain it further using this version of the ecological model. The version that you can see on the slide now, it shows you how imbalances of power between men and women and gender inequalities that exist, it exists in all levels of the society, right? So I'm using this example as we all know that systemic gender inequality exists in societies across the world, as you can also see in the diagram here. And it is a powerful driver of men's violence against women. In most societies, we know that men have greater access to power and resources compared to women. And these gender inequalities are created and reinforced through discriminatory social norms and practices and structures that lies within our families, communities, and institutions. And as we have been discussing since the beginning, it is important for us to note that while violence against women is rooted in gender inequalities and unequal power relationship between men and women, especially in the patriarchal systems, there is no single cause of violence. Also, there is no single pathway to perpetration. Therefore, I would like to repeat again, we have to remember that violence prevention requires interventions to address gender inequalities and all the other factors that we have just discussed, right, in all these 4 different levels. Okay, next slide. So while using the socio-ecological model, could you like show us all 4 points? Yes. So here are a few things for you to consider. First, think about the specific type of violence that you are addressing. Although there are some common factors for different kinds of violence against women, there are also some factors that vary. For example, if you're looking at IPV and female genital mutilation, right, FGM, you may find some unique factors for each of this form of violence as well as some overlaps, right? So remember the specific type of violence you are trying to address. Second, remember to analyze the factor in the specific setting where you are implementing your prevention programs or trying to implement. Although many factors are common across different contexts, the evidence that we have, it shows that some factors can be more important than others in a specific setting. Okay. And then next thing is the life course perspective, right? Remember, we discussed this also in our first session. It clearly showed us how different stages of life can put a woman at more risk to certain forms of violence, right? If you remember. That's why we also need to consider the age and circumstances of our target group while designing our interventions. And finally, the last thing to consider is that the factors that are important for perpetration may be different from those that are important for victimization, right? So it is important to be clear about the focus when you do your analysis using the social ecological model, okay? Let me quickly repeat again 4 things: types or form of violence, setting where it is taking place, the life course perspective, and different factors for victimization and perpetration. If you consider these areas, it will enable you to identify the most salient factors and strategies to come up with an effective program design. All right, moving on quickly, Manoj. Here, before we move on, we have some terminologies that we will be using in our upcoming slides. So we just wanted to discuss these here first, so we are all on the same page going forward. All right. So here first, we have risk factors. When we say risk factors, it indicates the characteristics of a society, setting, or individual that increases the likelihood of violence occurring. Okay. Likewise, when we say protective factors, we mean the characteristics that decreases the likelihood of violence occurring. And finally, situational triggers, like, with this, we mean any immediate events or circumstances that can precipitate an incident of violence. We've already talked about gender inequality being one of the key driver of violence, right? But other than that, there are various other factors that may increase the likelihood of violence occurring. And there are these protective factors, like, which also may decrease that likelihood. So it is important for us to be aware of it. Okay. Next slide, Mano. So yeah, when we talk about these risk factors and protective factors, it is also important to note that many of the risk factors that we will present here today, it can also be framed as protective factors. For example, like you see on the slide here, if we say social isolation of a woman is a risk factor, then because social isolation can increase likelihood of women experiencing violence. So if we say it is a risk factor, then social support can be a protective factor as it can decrease that likelihood, right? So just like a mirror, uh, and okay, so before I go ahead, let me just pause here for a while, okay? Because I know that the information I provided is quite heavy. And so before we move on with the presentation, we would like to have this break and take an opportunity to discuss what I just shared with you. If you have any questions, thoughts, or comments on the information I just shared. I see there is a comment from Sylvia. So just different terminology, not a single cause is always reason for violence to take place, but as they get to many possible causes or risk, there are more chances of violence to happen. Totally agreed. And I think that is what we just discussed, right? So any other thought? You can also unmute yourself and share. No thoughts, no questions? It either means I was super clear and there is no confusion, or maybe I wasn't clear at all. Okay, I think
you were clear, but if people have any reflections or any questions, Benita, they can unmute and talk to that. You were clear.
Okay, thanks, Rita. So maybe what we can just do here is like based on the information that we just reviewed and discussed, we can have today's breakout sessions here. And then what we will do today is like after the breakout sessions and sharing, we will again come back to some of this information, which will helpfully help you further to internalize it better. Okay, so for the explanation of today's group work, Rita, I'm handing over to you.
Great. Thank you so much, Benita. Yeah, so like we said, today's breakout will be incorporated into the session for us to go in deeper analysis and understanding of all these good explanations and that Benita gave us. So before I explain the breakout group work, I want us to know that for this one, we'll need to report back, okay? Like we do usually. But on the next slide, I'll just start with a reminder of what roles we need. For each group, we'd like that at least in a group, you have a facilitator, because we really value that you discuss and share the learning. We are here to learn from each other, right? So at least get someone who can facilitate the discussion so everyone's voice is heard. And also someone who is able to take notes, and a reporter. The same person could do both, but if you can share roles, we'd really appreciate. Okay, so on the next slide, I would like to explain what we're going to do in our groups. Okay, so we'll have a few groups. We are not many today. So in our groups, we'd like to start. If you remember, we had assigned you some preparations. So if you remember Mercy's story from the take-home exercise and also from the reminder email, we sent two stories, Mercy stories, part 2 and part 5, right? So we want you to say from those stories what risk factors for intimate partner violence you identified in the stories, okay? And also say what additional risk factors do you think may be relevant at this level of the social ecological model. So we will assign you to different groups according to the social ecological model that Benita explained. And from Mercy stories, if you identified what are the risk factors at your specifically assigned level, and what can be other risk factors do you think may be relevant, okay, according to the group you are assigned to the level of the socio-ecological model. All right. So we also want you to consider risk factors connect to gender inequality and additional risk factors. So as we think about that, please think about those risk factors in terms of how they are connected to gender inequality and any other additional risk factors you may be able to identify. So specifically for individual level, if you go back a little bit, Manon, on the previous slide. So we want you to be able to identify, like for the individual level, we want you to consider whether differently for women and for men. So say whether this is a risk factor for women's experiencing violence or for men perpetration of violence. Still in the story, you see this is a risk of women experiencing violence, and here is the risk we see as influencing men to perpetrate violence. I don't know if this is clear. This is specifically for those who will be working at individual level. And there is a link in the chat that Benita has put. And on the slides, you will see that for group 1, we'll have, how many groups? We can have 4 groups. And we'll like
we
that.
have 5 groups, Rita. So 1 level for each, and then for individual level, 2 groups, male and female.
Yeah, I'm thinking of the number of people in the groups, Benita. So checking the number of people we have, maybe for a good discussion, maybe we need at least 4 people in the group. So I was wondering.
We have 4 people. Yeah, with 5 groups, we have 4 people per groups and 1 group of 5.
Okay, so we can have five groups as anticipated earlier. All right.
Which group would you rather have 5 people in? Meaning, which, like interpersonal, individual, community, or society?
Maybe
I think
group
let's
one
make the
group 2.
individual. Yeah.
Okay.
Are you making the groups, Manon?
I mean, they're ready, so I can open the room whenever you want.
Okay, so for the individual one, you can have more people because we want to be looking at both for female and for male and female, for women and men in their analysis of the risks. So
so wait, so is the first group individual male and female at once?
Yes.
Okay.
1, 2, 3, 4, 5.
No.
We can have group 1 for individual level for men, and then they analyze what are the risk factors for men, and then all the analysis we want them to do, they will base it on men. And then the second group will be working on women, individual women.
Yeah.
What are the risk factors? Yes. And then for group 3, they will be looking at interpersonal level, if you can scroll. So this was group 1, you'll be looking at individual level. If you find yourself in group 1, you are at individual level for men, and then group 2, individual women, individual level for women. And then group 3, you work at interpersonal level, and group 4, you'll be looking at community.
I renamed the group, so each group has the name of social ecological.
That's great. That's great. So before we send people to the groups, I would like to see whether they are clear with how they are going to work in their groups, how it's going to work. So if you have any question about the assignment, maybe you go back to the slide with the brainstorm questions.
Also,
Manon?
a quick thing to add, Rita, if anybody in the group, like, if you have not already watched Mercy's video, we will also upload those links to the videos in the chat. Absolutely. So you can watch it first, and based on that, do your group discussions and analysis, okay?
Yes. So we're going to put the links to those in the chat here, but we can also come to your groups and share the links with you. But the links
are here. Yeah.
Oh, you did. So Mercy story part 1, part 2, and 5 are already in the chat. If you can open those before you are sent to the groups, that would be great.
I've already opened the breakout groups, so some people have already started joining.
Okay, so we can post again these to their groups.
Yeah.
All right. Okay.
Yes, I just joined.
Welcome back, everyone, from the group discussion. We hope you enjoyed the session and discussing, and we'll be happy to hear what you discussed. So for those who haven't got a chance to listen or to watch the videos, we hope you got an opportunity to watch again and then discuss. So I was able to pop into a few groups. We were doing good. So shall we quickly hear from the groups, reporting back, just touching on these key points so we can get back to the session. Like I told you, we still have a few slides to discuss after you report back. So group one, shall we start with group one? Any representative of group one to tell us what you did in the group for individual level, men? Over to you.
Thank you, Rita. Good afternoon once again. This is group one men. We had an interesting discussion and we came up with some points. Having listened to Mercy's story, we noticed that Clinton interacts with his friends, his peers, and then who encourage him actually to, who tell him that women are not supposed to ask for money. So he has that pressure from his peers. We also noticed that Clinton has a dominant masculinity trait, whereby he mentioned that he will go home and show Mercy who the boss is. Then there is lack of individual responsibility. We noticed that Clinton is not a responsible man. If he was, he would have gone out to look for a job and fend for his family. We also discussed additional risk factors. One, societal norms. In their society, we noticed that it's normal for men to beat, to suppress, and to harm women. And it's also normal for women to work while the men go out and have a good life. There is also lack of awareness around equality, because initially I think Clinton, Mercy, and colleagues had not had any NGO or any government or any person creating awareness about the rights of men and women, gender equality, and issues around that. Then we also noticed that there is an element of poverty in their family, because the little money Mercy is earning, everyone is looking at it from school to provide for school fees, food, even that's the money which Clinton actually goes out to drink from. So that's what we were able to discuss in a short time. Thank you very much.
Thank you so very much, Group One, for this interesting discussion. And we can see that you were able to pick those things that are really acting at individual level, like the Clinton's attitude and other things, and we'll have time to discuss further about those risks at individual level from Mercy's story and even beyond that. Thank you so much. And for also looking at other risk factors. Yeah, maybe we look at the story. If you looked at the story deeply and picked what are these other factors that can be influencing individual men to perpetrate violence, but this is also fine. So big applause to your group and hope you enjoyed the discussion. Group two, did you get a chance to discuss as well? Let's hear from them. You were working at individual level, but looking specifically at the female. Anyone from group two? You can just point a few of the points you shared.
Yeah.
Yes.
Yes.
Go ahead.
Hello.
Yes, Lan, thank you.
Yeah, so we were group two, and the one who was to present has some network issues, but I think I can do that for him. So we looked at the individual level for, female, and in the Mercy story, we see that Mercy is very worried that Clinton will come home drunk, because whenever he comes home drunk, he is usually violent, yells at her and beats her. So she's very worried that Clinton will, come home drunk. The second point is, actually that complements the first point, that she's, she's worried that when she confronts Clinton about his drunkenness or even the use of money, that Clinton will, turn the anger towards her. So the additional risk factors is that there are gender norms that are in the society that give men power over women, mostly financially and emotionally and physically. Yeah, we can see that many societies and gender norms give men the opportunity to have power over women. Thank you.
Thank you so much, Group 2 and Lan, for bringing that up. Yeah, we see that there is this attitude that Mercy adopts to accept violence, and that is probably due to the social norms around her, right? So at her as an individual, she has this attitude of accepting violence that is perpetrating on her because of everything that can be surrounding her. There's something that may be hidden that we don't see, but we look at that in depth with Benita in the next section. Okay, thank you so much, Group 2. Well done. Group 3, anything to share with us? Yes, looks like. If you can go on the next slide and then have one member of Group 3 to talk to this.
Hi, everyone. So
hello.
This is me, Natasha. So the thing is about the Group 3's presentation is about interpersonal labor. In terms of the master's story, we wanted to sum it up with few factors, starting from the regressive gender lens, then the cultural personal belief. The gender lenses, which I already mentioned, it's quite regressive, not progressive. The societal burden, homemakers being not respected and represented, and I think it's not that much difference the way we we face day to day in our lives as well in this part. I mean, especially the South I'm talking about. And children are affected as well. Definitely, I mean, when your mother is being under repression and also like under this kind of separation, definitely the child will be affected. No support from the core family and no support from the peers and surroundings, especially the neighborhood, because they're in a hesitational point because someone might interfere, then the same people will be facing some sort of backlashes. Why are you interfering? Then being judgmental. And in terms of additional risk factors, what we have discussed so far, first would be the child marriage, because there are some sort of cases of the safety and the security of the adolescent and the teenage girl of Mercy. And the power imbalance, this is quite obvious and quite visible. The rape and the sexual assault, because when the adolescent girl would be walking all around or being lonely, she could face it because that's already happened with one of the neighbor's daughters. And the violence towards the adolescent girls, that's for sure. The early pregnancy or teenage pregnancy, which is not only the case of Global South, but also in Global North. But the scenario of Global South is a bit different. It will be followed by the depression and the anxiety, the suicidal tendency, sexually transmitted diseases, substance abuse, illegal or illegitimate activities, the emotional baggages and burden from the trauma. And the last thing, that is the trolley effect. I believe in that because trolley effect is like you will be always in a dilemma who to sacrifice and who to sacrifice. That's what we face in that. Thank you so much, Mustafa, Dickens, and Samson as well. Thanks.
Wonderful. Thank you, Natasha and group member, for this thorough analysis and the key points that you raised. They really stood up for me. I particularly like the fact that you really brought it to specific context, you contextualizing it and seeing that there can be risks that are influenced by the whole other context, and the way you talk about Global North and Global South, that really resonates to me. And that's what we need to be considering when we do the contextual analysis and seeing the risks at their levels. So I know we are being cautious of time. I would love to hear from other people. Let's give the next groups a few minutes and we'll come back to that when Benita takes us through the next section. Group 4, I know you were discussing, I came to your group, but if you want to say one or two things, that would be great. Otherwise, we can also listen to group 5 and then give group 4 some time to reflect. Manon, do you want to move to group 5 and see? Yes. Can we listen to the group that worked on societal level?
Okay, thanks. Hi, everyone.
Hello.
I'm Tabile, representing Group 5. I'm representing Suman, Ajwang, and Sonia. So the risk factors from my story that we identify were that housework is not reflected as work in the family, because apparently the most important thing to do was the husband working as a laborer. And there's also no income opportunity for women. Also, society has adverse gender norms. A husband beating the woman is normal in the society, like beating is a normal part of marriage, as the society or the women or the people in the society view beating. So, additional risk factors that we identify that the husband is boss in the family. There are also not enough roles in the society to reduce gender-based violence. There's also societal burden, and also the people do not have an idea where to report gender-based violence, and also child marriage and early pregnancy, because the story of the rape girl, the people of the society, instead of addressing that issue of violence, but then they said the boy should marry the girl. Thank you.
Thank you so much, Tabile and Group 5. I can see there are some reflections in the chat. This is a great discussion, and we'll get back to that. Benita is going to take us through the analysis at all the levels. But before we move, there's a question from Pam. Pam, Group 3 made an analysis and based it in different contexts. So Natasha or any group member, do you want to respond to Pam, who would like to know more about trolley effect? Feel free to unmute.
Okay. I think the trolley problem is a thought experiment in ethics about the fictional thing. If I give you the scenario, like there will be 5 people in a group. If like a train crashes and might hit you, all of a sudden you have to save only one person. So I think the burden of carrying the trolley is like, it will hit only one person, but there are 5 people who needs to be survived. So what are you going to do? That ethical dilemma and the decision making creates the trolley effect. That is the problem. And the same thing, like when we are engaging it with the mass story, it's like, who is she going to save? I mean, from whom and from where? Like if you're talking about her adolescent daughter, like being perceived like an adolescent girl, like in the society, if you can't walk alone, if you can't go to your school, you can't study, you cannot do anything, what she's going to do? Definitely she will be in a dilemma. Either she will be saving her from the society, she will be saving her from the other perspectives, but what she is going to do? Either she is going to sacrifice in the name of safety and security, and that might be resulted, or the outcome would be towards the child marriage or teenage pregnancy. So these are the effects. Like saving 5 people at a time would not be possible. Saving yourself would not be possible in some of the cases, but saving one person, then, I mean, you are affecting either the 5 people or saving only 4%, but you are affecting only 1%. These are the trolley effect.
Thank you so much, Natasha. Clear, Pam, for you? And there are different examples of trolley effect or double effects that you can get. And some people talk about maybe if there is a pregnant woman who has got a disease and they need to make a decision whether they could abort or to continue the pregnancy and risk the killing of the mother. So there are many discussions around that, but I cannot really explain better than what Natasha and team did. And it's good to be looking at the risks, also making that kind of analysis. What can be that trolley or double effect that we're talking about? Great.
Yeah,
so
thank you so much, Natasha and Rita. I really appreciate that. Thank you.
That's great. Thank you so much.
Just I want to give the last conclusion. If you really want to save the 5 persons at that time, you have to change the direction of the trolley. Yeah,
See?
that's the last one.
That's good. Clearer.
Yeah, I mean-
Thank you, Natasha, for sharing. And yeah.
Hello.
Hello. Yeah.
Yeah.
Is it someone from group 4?
Yes, from group 4.
Yeah.
I don't know what happened. The note taker, people, I don't know what happened. You were supposed to have presented the slide.
Yeah.
But since I don't think maybe
Take-
network issue also. I will just summarize what we discussed in the group. Yeah.
Sure.
So in the group at the community level, looking at Mercy's story, we discovered that the community accepts some of this behavior like beating of a woman as normal, and that is the physical violence is being accepted in the community, and they see it as something that is normal. And economic violence also, Mercy going out to to earn some money, and at the end of the day, she's giving it to the gentleman, and nobody is saying anything, which means it is being accepted in the community. And also considering the fact that Mercy was covering it up, she wanted to maintain, or she is maintaining the culture of silence by not saying it out that this is what is happening in her family. She wanted to preserve or kind of keep it to herself because she knew, or from her experience, that her mother was also in the same situation. So because of that, she felt it is normal for her to also continue in the same way. So we now look at it as, okay, this is something that eventually will make these children, the community accept it, and the children will grow up, the men will grow up to be perpetrators of violence against women, while the women will remain as survivors of this. These are some of the key issues we discussed at the community level. The acceptance of violence against women in the community, and some of these norms. There are some bylaws like what we have, bylaws like what we have here in our context here in Nigeria. We have some bylaws. They are not written actually, but they are laws that people feel they have to do it. It is not written, nothing is being done if you don't do it, but because it is an assumption that this is how it should be, people go by it and they become part of their lifestyle, and that really encourage gender-based violence or violence against women at the community level. Thank you.
Wonderful. Thank you so much, Zainab, for summarizing what we discussed in the group. And this is so clear what we were looking for community level. Yes, how are people in your community judging or considering what is good or what is bad influences and constitute the risk of either perpetration or acceptance of violence to happen to someone. Well done, group. And if you have a minute, just put it somewhere. So for the sake of those who did not attend, if they wanted to read. Otherwise, I will say this was great. And yeah, we're going to discuss further this, aren't we, Benita? And I'll hand over to Benita to take us through what analysis we had prepared for you. Thank you.
Yeah, thank you, Rita. And when group 4 was presenting earlier, I quickly took notes on the slide. So some of the things you mentioned, Jenab, is already on the slide, but feel free to go back and add other points that I missed. With that, I thank you all for your very active participation and sharing. Hopefully, it helped you to brainstorm and discuss different risk factors using Mercy's story that existed in different levels of socio-ecological model, right? Now, to make this a little more clear for you, as I mentioned earlier, we will go over some of the risk factors and situational triggers of intimate partner violence across different levels of the socio-ecological model, okay? And you will note that many things that you discussed and shared earlier are already listed here. And we also hope that this sharing will help you reflect back on the group work that you just participated in and add more thoughts to that. Okay, so to quickly start, for an individual woman, as per the global evidence that we have, it shows that the factors listed here on the slide can increase her risk of experiencing IPV. And the factors are like the age of the woman, especially if the woman is young, then they are at higher risk, right? Also, evidence shows that the mental status of the woman, it matters, especially if she is experiencing depression and if she has experienced or witnessed violence in her childhood, like was the case with Mercy, right? And also, as we just discussed during the sharing, if the women, as Mercy herself, has attitudes that accept violence as a means of resolving conflict, or if she expects it, as part of her husband loving her, because this also exists in some context, right? We know if the husband doesn't beat me, then I start wondering if he doesn't love me, right? So if that type of tendency, if that type of beliefs or attitudes exist, then it also puts women at risk. And then if she has disability, okay? Similarly, for the individual man, uh, the global evidence shows that the factors are very much similar as women, but then there are few things like that differ. So we have age here, mental status, depression, experiencing or witnessing violence in childhood, that is also there. And if he has attitudes accepting violence or gender inequitable attitudes, right? Psychological dysfunction and harmful alcohol and substance use, especially excessive drinking. So all of these factors are known, like in case of individual men, for the risk of perpetrating violence. Okay, to move on in the next slide. Uh, Before I move on, here, I would also like you to know that there are few factors where we have mixed evidence, and they can increase or decrease risk of violence depending on the context where it is happening. For example, normally we say women's employment, or if a woman is financially independent, then that decreases risk, right? But then what we would like to be clear is depending on the prevalent norms about women's working and how it is perceived by men, right? This factor of women's employment and income generation can be a risk factor, or it can also be a protective factor for IPV. In particular, what we know from evidence is that in the shorter term, women working outside of her can increase the likelihood of experiencing violence in especially those settings where it is not common for women to work. But then in the longer term, working women can increase women's autonomy, their ability to negotiate in their relationship, and their ability to leave an abusive relationship if they decide to do so, right? So the same thing becomes a protective factor. Okay. Now to move on to next level, interpersonal level. Amano. Uh, Here, these are the number of factors that increase the risk of IPV, such as male dominance in decision making in the household, or violence accepted as an appropriate form of discipline for women and children, communication skills, high relationship conflict, or lack of rapport, trust, or emotional intimacy, and association with violent and antisocial peers, like we also saw in Mercy's story, right? And also social isolation and low social support, right? These all are listed as the risk factors at the interpersonal level. Moving ahead to the community level, here many factors that relate to predominant social norms around gender norms and violence, like expectations of men and women, how they should behave in a marriage or in an intimate relationship. And uh, you can also see the examples, uh, on the slide here, like especially norms such as condoning male authority over women, or norms linking men's honor to women's behavior or purity in some contexts, such as women who do not behave as expected, they are seen to insult the man or his family. And it could be also norms like which says it is acceptable for a man to beat his wife in certain circumstances, right? And it may be about not fulfilling household tasks or not going out, like could be like, women going out without telling him, right? So norms related to that. And then uh, something I find very common across different settings are norms around family privacy or honor. For example, in Nepal or many part of Asia, like we have a strong norm that what happens inside a home is a private matter. So if violence happens at home, then like it should not be spoken of in public, and it is not a matter for the community or state to get involved in, right? I believe this applies to many other contexts as well. So what I am saying here is at community level, presence of these harmful norms increases the risk of IPV. And another factor that we can take a look at the community level is whether there are effective social or legal sanctions for violence. If there are no response from the peers or community or police when someone perpetrates violence, then it becomes a risk factor, right? Uh, quickly moving on to the society level. This is something I noted in all of the presentations from earlier group work. Like, although you were looking at the different specific levels, I noted that many of you have included gender discriminatory laws and policies as something like additional risk level, right? So this is something we see at play at the societal level. Uh, the examples of such laws and policies could be inheritance rights for land or property, or discriminatory laws. For example, like, if there is a divorce, who gets the custody, things like that. And then collectivist cultural orientation, which means if the reputation of the family or community is valued over the rights or well-being of an individual woman. And then there are other factors like armed conflict, political instability. All these things listed here are known to us as risk factors at the society level. Okay. So I believe we still have some time. So Manon, maybe like, I can go quickly through the situational triggers as well. Yeah, okay. So recent research on IPV on heterosexual relationship in particular has identified situational triggers as an important factor for a violence to occur, right? And if you remember my definition from earlier, situational triggers means immediate events or circumstances that can cause conflict in a relationship and precipitate an episode of violence, okay? Uh, I know that we had planned to also have some discussion and interaction with participants here, but in the interest of time, maybe I will quickly move on, Manon. So if you can show us rest of the information on the slide, thank you. So here, these situational triggers relate to instances where a man or a woman fails to meet certain gendered expectations. For example, a man may beat a woman as a form of discipline, as I already discussed briefly, for not being able to prepare a meal or to take care of the children properly, or conflict can happen if a man does not bring home sufficient money for the household, and thus failing to meet a gendered expectation of men as providers for the family, right? Similarly, feelings of shame, inadequacy, or anger, it can also prompt men to respond violently, especially if they feel their authority or masculinity is somehow threatened. And other frequently mentioned trigger for both physical and sexual IPV is a women's refusal of sexual intercourse, especially in a marriage, right? So uh, what we are saying is it is also important for us to be aware of these things while we do our analysis of certain form of violence in a certain setting. Okay. And now to help you connect these risk factors across the different socio-ecological model. Next slide, Mano. Here, what as we have mentioned, different risk factors at different levels of the model interact and reinforce with each other, right? So at the individual level, women's employment and her ability for income generation. At interpersonal level, it can be male dominance in decision making. At the next level, the community level, factors like poverty and unemployment and community. And at the last level, society level, it can be existing laws, policies that are gender discriminatory. All of these things we have already discussed. To move on, let's also take a quick look at how these identified risk factors should be targeted through the different prevention activities, right? So at the individual level, as you can see, it can be programming related to social or economic empowerment. At interpersonal level, we know that there are some couples programming which are known to be very effective. At community level, there are community mobilization activities, right? And at society level, our programming can be related to legal policy reform. We just wanted to quickly mention here for you to connect the dots, but I believe we will go into much more detail next week on prevention strategies. So do not worry about me going through these slides very, very quickly, okay? And just to wrap up this presentation today, here, next slide, Mano. This is our final message to you all, from today's discussion. From all that we discussed today, we've understood that violence is never inevitable, right? So it might be one possible outcome in a situation, but it is not decided. It can never be confirmed that a certain situation will definitely result in violence. And hence, as I said, it is not inevitable. So let's remember that, all right? Okay, I think we are doing okay with time, so I'll quickly hand it over to Rita to continue further and discussion on the take-home exercises. For any questions or comments that you may have, I request that we can have that discussion through emails or during next session when we discuss today's key messages, because we're running out of time. Okay, I'm so sorry about that. Rita, over to you.
Thank you so much, Benita, and thanks so much to those who were interacting in the chat. So Benita, there were good interaction in the chat as you were talking us through the triggers, especially talked about situational triggers. People kept sending those in the chat. So that's the type of interaction that we really want to encourage for co-learning purposes. So thank you so much. We already know that it is a lot of information for us to digest, but it's not also new information for many of us, because this is what we do in our everyday programming, right? So just a few, highlights of what do we consider as risk, what are the situational triggers. This is just a reminder for many of us, okay? So we'll encourage you when we send the reminder, the follow-up emails, to look at the notes again and then think about your programming and be able to unpack that further. And this is what the take-home exercise is introducing us to. So what do we want to do for this week? Take home, Manon, if you go to the next slide. We want to go back to where we started, okay? Let's go back to session 1 and think about the data that you reviewed in your assignment and any other available data in your context. You remember we talked about admin and prevalence data. So we are encouraging you to go to the prevalence data, all right? Choose one specific type of violence that occurs in your context, or a context where you work, a context you read about. So don't limit it yourself because you say, I don't have a program that is running now, but you can also, it could be something that you read about, but we encourage you to look into your context, be context specific, all right? Analyze the risk and protective factors. I know Benita took us through this, and then we went into our groups to discuss that. We want you to analyze the risk and protective factors at different levels of the socio-ecological model, of course, and consider which evidence-based prevention strategies might address the risk factor you are identifying. So first of all, there is that data that you identify, and then you choose a type of violence that you see occurring in that context where you work, and then you analyze it. You analyze the risk factors that are existing, the protective factors at the different levels, as we just discussed today. This is, it takes you really into a thorough analysis, okay? And we'll be there to answer any question if you want. So Manon, if you go slowly through the slides, this is how the slides will be looking like. So what we want is, again, like Karen did, share some background information about your context and the type of violence you are focusing on. All right. These are key for us to understand now how you unpack it further. All right. Then you provide the source of data. It's good if, as you know, you cannot give everything in that assignment. If you can send us the reference so people can read further. This is why we're here, to learn from each other. All right. And then describe the context very, quickly so everybody knows. And then on the next slide, we're going to do the analysis. Manon, can you click and then they see? This is how your analysis will look like. So we want you to go through all the levels of the socio-ecological model and be analyzing the risk factors, protective factors, and the potential prevention strategy to address the risk factor. I think it's clear. So go into that specific context, and with the data that you have identified, see what are the risk factors and see what are the protective factors, and then say what is, maybe you already have a strategy that is being used in your programming. What are the possible strategies that can be used to address the risk factor? Yes, we know we are anticipating. Next week we'll be talking about strategies, but we already know that you have some strategies that you are using. So we'd really like you to make that analysis and share with everyone, and make sure that you are looking at the different levels. All we need to know is, like, in application, as a follow-up to this session of today, being able to differentiate and see what are the risk factors, what are the existing protective factors, and how can we do to address these risk factors? What are the strategies that we can apply? Okay, does that make sense to people? I want to see if it's clear. I know we'll follow up with email, but in a chat, by a yes or a thumb up, tell us if at least the take-home assignment is clear. Yes, I see a yes from Pam. Good. Yes, Kajuju. That's wonderful. Clear, Suman. That's great. So thank you again so much, Manon. If you can go to the next slide. As usual, we need you to complete the assignment. You're already used to that. I've seen one assignment coming to my email. That's not a problem, but please make sure that you are submitting to Learning Lab email that we gave you here, and mark the assignment as assignment reception support. This is exactly what we want you to be doing. Thank you. And Benita and myself and some other colleagues in the background, Manon and Rubina, are here to support if you have any problem with your assignment or any other thing. I will encourage people to use the discussion board. There was an interesting discussion in the chat earlier today about the trolley effect. If you have any other concept you want us to discuss to deepen our learning together, we'd really appreciate. Okay. And with that, I really thank you. You have ways to stay connected with us. On the next slide, please, if you have anything that you would like us to look at from your social media as well, please let us know, and then we can be connected to each other. And with that, I thank you so much. We thank you so much for showing up. We know this is a very important day. We wish you a very happy International Women's Day and a good continuation of celebration in your own communities, at work, share what you've done with us next, on the discussion board. And bye-bye. See you next time.
Bye-bye. Take care, everyone.
Take care. Mano, you can stop sharing so we can see each other. Thank you so much. Thanks, everyone. Thanks, Natasha, Leku. Bye.